Good afternoon and welcome to IACAC's Virtual College Exploration Series for Illinois students. For those who are joining us, you may ask questions live through the Q&A button, which is at the bottom of your screen. You can click that Q&A anytime and type in your questions. They will not be shared with anyone here other than the presenters. Your camera and your microphone are off, so we cannot see you or hear you, but we will be very happy to answer your questions. If you do type questions into the Q&A, know that they will be answered, if not during the presentation, just to make sure they can get through all the material, definitely at the end of the formal presentation. Also a reminder that you can sign up for more sessions. There are still some available through iacac.org, and this is being recorded as well as many other sessions that we've hosted, and those also are available at the iacac.org website. So with that said, I'm going to stop sharing, and I'm going to hand it over to Grace and Allie, who are here from Drake, so you can take over. Have fun.
Awesome. Thank you very, very much. Grace, I just want to do a quick check with you that we can see my slideshow. I'm going to share the whole screen. Are we good to go?
Yep, you're good.
Awesome. Well, welcome everyone. Thank you so much for being in attendance today. My name is Allie Harms, and I am Assistant Director of Enrollment Services in the College of Pharmacy and Health Sciences at Drake University. So my role in your life, should your interest in Drake continue, which of course we hope that it does, is to kind of serve as an extension of your admission counselor. If you're working with Drake or working with any school for that matter, you likely have an admission counselor assigned to you, and they're kind of there for any and all Drake stuff. So like, you know, your application and scholarship questions and timelines and visit opportunities. But sometimes you might have really specific questions about your major or your program if you're interested in healthcare that maybe they aren't quite sure how to answer, in which case I will step in. And then I also help recruit for our graduate programs, which we will be talking about today in the next 43 minutes. So let's talk about the College of Pharmacy and Health Sciences at Drake. So Drake is a university, and we're broken up into different colleges and schools. So like there's the College of Arts and Sciences, there's the College of Business, the School of Journalism. We are the College of Pharmacy and Health Sciences, and we have 4 programs. We have the Health Sciences major, we have athletic training, we have occupational therapy, and we have pharmacy. And these are all different varying degrees of degrees. So the health sciences is a bachelor's degree program. The athletic training is a master's degree program. Occupational therapy is a doctorate program, and pharmacy is also a doctorate program. So we are going to be talking about these in length today. And the first thing I want to make sure that we mention, if I can advance the slide here, is that Drake really focuses on something called interprofessional education. And if you are interested in healthcare, this is something that I hope you listen for when deciding on a college. So especially in healthcare, if you are, like, let's say a nurse, the nurse has to know what the anesthesiologist does. The anesthesiologist has to know what the pharmacist does, who has to know what the healthcare administrator does. There are all of these different roles on a healthcare team, and in order to serve the patient to the best of their ability, everybody kind of has to know what everybody does. So Drake really focuses on something called interprofessional education, where you aren't just learning from faculty members in the area you want to pursue. You're learning from faculty members from all different healthcare disciplines, and you're learning alongside students who want to go in different directions as well. Because again, if you know what everybody's role is on a healthcare team, that's only going to help the patient, and the patient is certainly at the center of it all. So let's start with health sciences. This is a bachelor's degree program that we have, and I'm not going to spend too much time talking about this program because I think the focus of our time together are our 3 graduate programs, but health sciences is kind of the foundation of it all anyway. So you hear the term health sciences, right? And I think some people are confused by what that major means. So, you know, maybe if you're an accounting major, you know you're probably going to be an accountant, right? If you're an education major, you know you're probably going to be a teacher. So if I'm a health sciences major, does this mean I am a health scientist? No, health sciences is basically a super strong and super solid foundation in virtually any healthcare career you could ever possibly want to pursue. So at Drake, we have two different tracks of health sciences. We have the clinical and applied sciences track, and we have the healthcare administration and public health track. So the clinical and applied sciences track is for that more direct patient care, that hands-on side of healthcare, for people who want to like be on the front lines of healthcare in whatever capacity that is. Whereas healthcare administration and public health are for people who want to, you know, maybe work in public health, work in healthcare administration, be the CEO of a hospital someday, be an office manager at a hospital, go into medical sales, that more kind of behind the scenes business side of healthcare. And then this visual aid here, if you go to the bottom two squares there, will show you just a small sample of careers that are associated with each of those different tracks. So within the health sciences major, we have these things called designations. So we have a lot of people that come to Drake and say, I know I'm going to be a doctor. I know that I want to go to med school. So you can assign yourself a designation as a health sciences major. So that person would say, I'm a health sciences major with a pre-med designation. Somebody else might say, I know for a fact I want to be a dentist. So they can declare themselves as a health sciences major with this pre-dentistry designation. Some people say, I have absolutely no idea what I want to do at all. That's the majority of people, but I know that I want to do healthcare. You can just have a health sciences major and not have a designation. That designation is more for our students to be able to feel that they have an identity within the program. So if this week you want to be pre-med and then a month from now you want to be pre-nursing and then 6 months from now you want to be pre-vet, that's fine. You don't have to go through a whole crazy application process to change your designation. It's just more to keep you on track. So even if you change what you want to do in healthcare 6 different times, you don't have to ever change majors. You can still stay a health sciences major. So here is a question I get all the time, and it might be a question that is on your minds. So you might be somebody who knows that you want to go into healthcare, right? But you might say, like, how do I know what I major in when I get to college? Am I supposed to major in biology and be pre-med or pre-dentistry or pre-whatever? Am I supposed to be a biology major? Am I supposed to be this health sciences major I keep hearing about? Am I supposed to be a chemistry major? Am I supposed to be a psychology major? And the answer is, there's no right answer. And I hope that makes you feel good instead of discouraging you. There are so many majors that provide really solid foundations for any graduate school and a professional program. Because I work in health sciences, though, it is my job to say why I think our program is different. So that brings us to the health sciences core classes. As a health sciences major at Drake, our students take a series of classes that you don't find in other science majors. So let me back up. In health sciences as a major, in biology, in biochemistry, in chemistry, you're gonna take all of those science classes, right? In all of those programs, you're taking biology, you're taking chemistry, you're taking organic chemistry, you're taking medical microbiology, you're taking anatomy and physiology, medical terminology. Those are classes that you see in most kind of science-related majors. However, we have this series of classes called the Health Sciences Core, which are about healthcare specifically that you don't find in those other science majors. I won't go through all of these, but I do want to give you some examples. So like Introduction to the Health Sciences, that's a class you take your very first semester, your freshman year. Like you might come to college and say, I want to be a pediatric oncologist. And that's a beautiful thing. And maybe you will be a pediatric oncologist, but there are so many healthcare careers out there that you might not even know exist yet, but that could be a perfect fit for you. So it's our job to expose you to as many of those as we can. So in your very first semester, we talk about lots of different types of healthcare jobs. We bring in guest speakers. We go out and do job shadowing when we're not in a global pandemic, and all sorts of stuff to expose you to all sorts of different types of healthcare careers. Another example is we devote an entire semester to the US healthcare system. We do not have a simple system. Some might argue our system is somewhat complex, so we have an entire semester about it. You have an internship and a research project your senior year. So the health sciences core is what really distinguishes our major, we feel, from other science majors, where it's not just about science, it's about healthcare. And that really is a unique aspect of the major. I don't know if any of you have had the chance to come to Des Moines, but I think that is one of the many places where Drake really shines. We are a relatively small school in this capital city of like well over 600,000 people. There are 5 major hospital systems within a 20-mile radius of campus, not to mention the countless care facilities and clinics and doctors' offices and pharmacies. So there are more opportunity for like internships in Des Moines than we even have students to fill them. And that's fairly rare. I think a lot of times you go to larger schools that are in smaller towns or cities and it's really competitive. So that in a nutshell is our health sciences major. That is our 4-year bachelor's degree program at Drake University. Now, I would like to move on to our 3 graduate programs. So like I said, we have a pharmacy, a PharmD degree, which is a doctor of pharmacy. We have an MAT, which is a master's degree in athletic training. And we have an occupational therapy doctorate degree, or an OTD. And we're going to go back to these visual aids of the different squares here in a little bit. So let's start with athletic training. That is it's called a 3+2 program. So the first 3 years is health sciences, essentially. So everything I just said about health sciences for the last 7 minutes, copy and paste that in your mind, and that is your first 3 years at Drake. Pre-athletic training is the health sciences program. And then your last 2 years is the professional program. So technically your senior year at Drake is your first year in the AT program. And you graduate in 5 years with 2 degrees, your bachelor's degree in health sciences and your master's degree in athletic training. So there is a visual aid there. The light blue squares represent pre-AT, your undergraduate years. And then your junior year or your 3rd year at Drake is when you would apply to the professional program. So what is an athletic trainer? I think that it can be kind of confusing. Our very own chair of the department made this little visual aid to kind of poke fun at the confusion that surrounds athletic training. My personal favorite is the bottom left-hand corner, what society thinks I do. Apparently, if you say you're an athletic trainer, a lot of people think that you are like a personal fitness instructor at a health club. That is not the case. So what does an athletic trainer do? They do prevention of athletic injuries and illness. They do therapeutic exercise. They do treatment, rehabilitation, and conditioning of athletes. They provide emergency care to athletes. They do diet assessment. And because we are a master's program, we have an elevated degree. Our students get to do some really advanced things. So they get to do stitches and give immunizations and give IVs and things like that, that you wouldn't necessarily be able to do at the bachelor's degree level. So here are some photos of athletic trainers in action. Some of them might look pretty standard, but some of them might be kind of surprising. Like you see people working like in some sort of musical show. You see people working with the military. So where do athletic trainers work? About 50% of the profession is that more traditional setting, right? The high school teams, college teams, and professional teams. But that's only about 50% of what the profession is. The other 50% is more non-traditional settings. So athletic trainers can work in hospital emergency departments. They can work in the armed forces, law enforcement, industrial settings, and the fine arts. Like if you think of Cirque du Soleil or any musical or Broadway show where the actors move a lot, I mean, they are certainly athletes. They're dancing, they're moving, and if they get injured, they will need people on hand who know what to do. So we have a really neat program. There's this really neat ceremony that we do called the Blue Coat ceremony. For our 2 other doctoral programs, we have a white coat ceremony. So when people, start the professional program, they get their doctor's white coat to show that they're about to start learning as a doctor. But athletic trainers would look kind of silly running onto a field in a white coat. It would probably get dirty really fast. So our students get these really cool blue coats, these windbreakers. And here's a photo of 3 of our students at last year's blue coat ceremony, hanging out with Griff, our live mascot. We also have concentrations available. So if you wanted to be an athletic trainer with a focus in mild traumatic brain injury, for example, that's a huge topic of concern right now nationally with football and how people are getting concussions and having long-term problems. So that concentration is very relevant right now. There's prevention and wellness, global and comparative public health, leadership and evidence-based healthcare. Those are areas that our ATs can kind of specialize in if they wish. So since you're not here on campus, I wanted to show you some spaces. So this is our athletic training lab. It looks and feels just like an actual athletic training room. So our students can work with instructors to develop all those skills we talked about, like suturing, inserting IVs, evaluating injuries. Here is the actual Bell Center athletic training room. This is our Sleigh running track, and when you look at it, I know what you're thinking. You're thinking, Allie, it looks like a hallway. That does not look like a track to me. This is actually one of the most unique tracks you will ever see. It's a biomechanics runway, which uses motion capture software to evaluate all types of movements from throwing to sprinting and everything in between. And it's a really neat way to look for abnormalities in the way an athlete moves that could cause them injury. So in the floor, there are different measuring plates and technology to measure different things. And then kind of down the hallway to the left, you can see those windows. That's the control room where all of that data is collected. So it is not just a hallway. So that is our athletic training program in a nutshell. That is, again, a master's program. It's a 3+2 program. So let's move on to occupational therapy, which again is a doctorate degree. This is a 3+3 program. So the first 3 years of pre-OT, again, is basically the health sciences major, getting that strong foundation in science classes and in healthcare classes. Then your senior year, actually let me put it on this one. So then your senior year is technically your first year of occupational therapy school. And then it's another 2 years to complete the OTD. So in 6 years, students graduate with their bachelor's degree of health sciences and their OTD, which is their occupational therapy doctorate. So what do occupational therapists do? I must admit, so I'm in my 14th year working at Drake. We got occupational therapy maybe 6 years ago, and I didn't quite know what it was either. I thought, one, maybe it was just like what a physical therapist does. There's some overlap, but there's some very significant differences. But I thought, okay, occupational therapy, occupation. Is this somebody that helps people get jobs? Like, what does that mean? So to read the slide, it says occupational therapy is the only profession that helps people across the lifespan to do the things they want and need to do through the therapeutic use of daily activities or occupations. So an occupation in this context is anything that occupies your life in your daily activities. So all of you probably woke up this morning and got dressed. That's an occupation. Maybe you cooked breakfast, or you ate breakfast that somebody cooked for you. That's an occupation. Did you drive today? That's an occupation. Did you work out? That's also an occupation. An occupation is anything that occupies our mind, our time, our life, our body, our interests. And sometimes due to, some sort of disability we were born with, or an injury or an illness we sustain in our lifetime, we're not able to perform these activities to the best of our ability. And that's when an occupational therapist comes in and helps us do these daily occupations in the best way we can, whether it's through physical rehabilitation or adapting or modifying things to just make life easier. So the quote at the bottom I absolutely love. It's, an occupational therapist will ask what matters to you, not what's the matter with you. It really is about you as a whole person. And I must tell you, occupational therapy as a career is growing at an absolutely insane rate. There is so much job opportunity in this field. So where do OTs work? Literally everywhere. They work everywhere. And at Drake, we teach students to be generalists. So if you wanted to work with kids, you know, I don't know, for 10 years, and then you get tired of playing on the floor with them and you want to work with the aging population, you're already trained to do that. You can jump from profession to profession within the OT field very, very easily. So why occupational therapy? At the top there, employment is expected to grow almost 30% in the next 10 years. Therapy has pretty great hours if you want to be a doctor but not work like what I think you would think a traditional doctor works. Usually happens between 9 to 5 on weekdays. You have opportunities for specialization and mastery. So, you know, you can work with teeny tiny little preemie babies, to people with autism, to the aging population. You can specialize in burn victims, hand therapy, wheelchair management, somebody who's had a stroke or suffered a traumatic brain injury. There's literally no limit to the different areas that an OT can work in. It embraces the mind-body connection and has a holistic approach to healthcare. Occupational therapy is very mental health and counseling focused. It's not just on whatever is quote unquote wrong with somebody, but it's about making sure they're okay as a person. So there's a pretty heavy psychology component to occupational therapy, if that interests you. And you get to just be really creative. If you're somebody who likes to be creative, think outside the box on how to help a specific person with their specific situation. If you like kind of puzzle solving, OT could be a really, really good fit for you. No day is the same and you get to be incredibly creative. So let's look at some of these learning spaces. We have an occupational therapy building, and this is a picture of kind of the plaza area, the middle area. We do have a car in the building. We don't call it a PT cruiser, we call it an OT cruiser, just because we're terribly clever people. We have a whole fleet of wheelchairs, and you can see on the right there, there's different surfaces, like there's grass, there's cement, there's gravel, just to kind of learn how to navigate different terrains with like a wheelchair or a walker or a cane. We have a Hyvee grocery store, like a little mini one that we use for all sorts of different things when working with the public. We have a fully functioning 1-bedroom apartment that has all sorts of technological modifications to help someone who lives at home but maybe needs some help with different things. We have an ergonomics office. Ergonomics is the study of the body and body mechanics in a workplace. So they do full evaluations on people who work in offices to, like, does your neck hurt? Are your eyes strained? Let's figure out what can change within your office to maybe make you a little bit more comfortable. And this is our PEDS lab, our pediatric lab. Little kids learn by playing. So that room usually just looks like a huge jungle gym, which is really fun. So that is just a tiny taste of the occupational therapy program and what that is. So the final program that we have at Drake in the College of Pharmacy and Health Sciences is our Doctor of Pharmacy. That is a 6-year program. It is a 2+4 program. So it is 2 years in pre-pharmacy and then 4 years in the professional program. So when a student graduates from this program, they will have their Doctor of Pharmacy. And one thing I really want to emphasize, if you are somebody interested in occupational therapy, if you are interested in a Doctor of Pharmacy degree, I really encourage you to ask every school how long it truly takes to graduate with your PharmD. There are some schools that, you know, it might take 8 years because you have to get your full bachelor's degree and then your 4-year PharmD. There are some schools that say they have a 2+4 program, but if you do a little bit of digging, it's really rigorous and really difficult, and only a small percentage of students actually are able to do it. Drake has what we call a true 2+4 program. It is designed for every single student to graduate in 6 years with their PharmD. And I would say 99.999% of our students are able to get their PharmD in 6 years. So I'm going to repeat that one more time. If you're looking at pharmacy, please ask schools if they're touting a 6-year program, make sure you ask how many students are actually able to complete it in 6 years. So why pharmacy? Why would somebody want to pursue pharmacy? Well, it is a helping profession. You have the ability to impact healthcare for individuals and populations. There is a lot of public respect associated with being a pharmacist, and there is a wide variety of career opportunities. Now, when I started at Drake in 2007, I thought to myself, pharmacy, yes, I know exactly what they do. A pharmacist stands behind the counter of my neighborhood Walgreens and greets me nicely as I pick up my medicine. And that's called community pharmacy or retail pharmacy. And I don't want to make the mistake of acting like that's not an important job. That is an incredibly important job, but that is just a tiny little sample of what's available. In fact, about only 20% of our graduates go into community pharmacy, and the other 80% go into other areas. So here's just a small sample of some career pathways. I didn't know before I started at Drake that, you know, a pharmacist could be a part of a hospital care team and do rounds with the medical team. I didn't know that there was such thing as, you know, nuclear pharmacy, where you work with legitimate radioactive materials to make medication for cancer patients. We have a graduate who works for a poison control center. We have a graduate who works in politics and legislation on behalf of the profession. We have a graduate who works for a migraine management center. We have a graduate who works for the VA and works with veterans. You can work in the business sector for like an insurance company. There are you can even specialize. Like you can work in infectious disease. That's, you know, obviously a very important field right now. You can work in oncology pharmacy. You can work with cardiovascular pharmacy. You can work in mental health care pharmacy. So there's just so much you can do. So when you look at this list, that might overwhelm you. So one thing I want you to know is there is a very special class called CAPS at Drake, and it's only for pre-pharmacy students, and it basically helps you decide if you want to pursue pharmacy. So we bring in tons of guest speakers and lecturers, and we talk about the different types of pharmacy jobs out there and the issues that are facing the field of pharmacy and the direction that the profession is going. And if for any reason during those first 2 years of pre-pharmacy, if you decide that pharmacy isn't for you, it is so easy to change your major. Not a lot of people, but anybody who decides that they no longer want to pursue pharmacy, they usually just switch to a health sciences major and become like pre-med or pre-something. If you get into our pre-pharmacy program, you are not bound to finish. That's what CAPS is for. CAPS really helps you get to know the program in your pre-pharmacy years before you actually start the program. So here's just kind of a general outline of what those 6 years at Drake look like. So your first and second year are pre-pharmacy. And then here's just an example of what you take when you're in the professional program. And I did want to draw your attention to year 6, that P4 year. That is when students do their rotations. So your 6th and final year of pharmacy at Drake, again, your P4 year, you would not take any actual classes. You're out doing your rotations. That's like your real life hands-on kind of like, I don't even want to call them an internship. It's a little bit more intense than that, but you do 8 different 5-week rotations. So imagine starting a new internship every 5 weeks and then doing that 8 different times, and that's your P4 year. And because Drake has been around so long, we have over 600 active practice sites for your rotation. So you pretty much get your first choice for all 8 rotations. Maybe you want to go into warm weather in the cold winter months and you want to do a rotation in Phoenix or, you know, down in Texas. Or Belize, that's a very popular one. Maybe Aunt Sharon lives in the Twin Cities and you'd love to stay with her for 5 weeks. We can definitely make that happen. So it's a very, very flexible program that allows our students to pick the rotations they want. So why pharmacy at Drake? Again, we've just been around a really long time. We have some amazing relationships and just an incredible reputation. So you have a lot of opportunity for professional development and leadership and advocacy and research. And here are just some more of our partnerships and that we have with local and national organizations. We have an extremely high job placement rate. This isn't just for pharmacy, but this is for all of our programs, essentially. And here is a little pie chart that shows where our graduates have recently gone. Remember, I said only about 20% of our students go into community or chain pharmacy, and the rest do all sorts of other different things. You're going to see that word residency, and that's something that we're really, really proud of. It's actually back here as well. If there's something that you really want to specialize in as a pharmacist, you typically have to apply for a residency, and you would do that after you graduate from Drake. You still get paid, you still make really good money as a resident, but it's just getting specialized in a certain area. And residencies are very, very, very competitive. But as you can see, Drake was #1 in the Midwest last year for matching, and the #1 private school for matching on your residency. So basically, if you want to get a residency at Drake, or if you want to get a residency in general, your chances of getting matched and getting into a place that you want is very high at Drake. I know that money is always a concern. College is very expensive, but according to Payscalecom, last year, pharmacy was in the top 10 of highest paying college majors. So that's kind of fun. And why stop at a PharmD? So graduating in 6 years with a Doctor of Pharmacy is very impressive, obviously, but we have opportunities at Drake to make you even more impressive. So we have some agreements with other programs that help you to, in the same 6-year period, get some advanced degrees. So for example, the Master's of Business Administration, the MBA at Drake, that's in our business school. If you're okay with taking some summer classes, you can walk across the stage at graduation and get your Doctor of Pharmacy degree and your MBA, 2 degrees like that in 6 years. And we have other opportunities in other programs as well, just to make yourself stand out when it comes time to graduate and get a job. So some more facilities for pharmacy. This is our Davidson Pharmacy Practice Lab. This is a lab where students learn skills in like patient education, prescription processing, administering immunizations, performing medication therapy management. It's a very functional classroom. Everything can, all of the furniture is movable. This is our compounding lab where you actually get to like make medications. This is our Pharmacogenomics Lab. I know that's a very long word, but pharmacogenomics is a very up-and-coming field in pharmacology. It basically combines pharmacology, which is the science of drugs, with genomics, which is the study of genes and their functions. So that's a really cool combination. So that was pharmacy in a nutshell. So now you have learned about all 3 of our graduate programs. So now we're going to get into something called the Drake Direct Admission Program and the benefits that are associated with it. So I know you've seen these little blue squares many, many times, but here's just a refresher on the sequence. Pharmacy is a 2+4, athletic training is a 3+2, and occupational therapy is a 3+3. So no matter what program you're in, if you do both your undergrad, which are the light blue squares, and your graduate work, which are the dark blue squares, if you do both of those at Drake, you get some very unique perks called the Drake Direct Admission perks that other people wouldn't get. So basically, the perks of Drake's pre-programs. If you are a pre-pharmacy, pre-AT, or pre-OT student, you might be worried about, okay, well, Allie, how do I actually get into the professional program? Do I have to apply? Yes, you do. But as long as you end your pre-AT, pre-OT, or pre-pharmacy years with a 3.0 or higher, and you do well on your interview, there is a reserved seat waiting for you in the professional program. You're not competing with your classmates to get these coveted spots in the graduate programs. Like, let's pretend you're pre-pharmacy. If at the end of your sophomore year, at the end of your pre-pharmacy sophomore year, you have a 3.0 and you did well in your admissions interview, you have a spot waiting for you. And that's huge. So here, are some other benefits to Drake's direct admission program. Pardon me, as I said, it's available to all pre-AT, pre-OT, and pre-pharmacy students. You have that reserved seat in the professional program. You're guaranteed to get an admissions interview. We might have students applying from other schools who did their undergrad at other institutions. They might not all get an interview depending on demand, but if you're already a Drake student, you will definitely get an interview. We also waive the admission test. So I know you've all heard of the ACT or the SAT. There are more tests involved usually to get into professional programs. So there's like the GRE for grad school, there's the PCAT for pharmacy school. Those are waived if you are already a Drake student. You also get to join professional organizations as a freshman right away. You get to really connect and explore the profession right away your first year. And your academic advisor, your very freshman year, is a professor in that program. So it's not like if you're a pre-occupational therapy major, you just have a general advisor, and only when you finally get to the professional program do you finally get your OT advisor. No, you would have an OT advisor who's a professor in that area on day one of your freshman year. So you have that guidance the whole time. So I just have a few more slides of facilities. So these are facilities that anyone gets to use, whether they're health sciences, pre-AT, pre-OT, or pharmacy. These are for everybody. So the first one is our anatomy lab. This is so cool. We use 3D technology. So students put on 3D glasses and the screen literally jumps out at you and you get to dissect human bodies in a 3D virtual space. Very cool. We have the Porter Clinical Skills Center. So it's basically like a safe place to practice life-saving skills without like the stress of working on a real person. So we use what are called high fidelity mannequins that do everything from talk to run a fever to scream in pain. They can throw up, which is kind of gross, but kind of cool. So you get to practice skills on these mannequins before you actually have to touch a real person. And they're kind of crazy how lifelike they are sometimes. This is our newest space. It's called the Interactive Healthcare Center. As you can see, it's divided up into individual rooms that can be set up to simulate exam rooms, like in a hospital and a clinic. So you can practice working one-on-one with patients, and there are video recording capabilities so you can record your sessions and then reflect on your practice. This is our Ellis Disease Prevention Lab. So in this room, students can use like state-of-the-art fitness equipment and learn different techniques for physiological fitness testing. Here is one of our larger lecture halls. It's called Harveyingham. I believe it holds up to like 150 people. That's the largest lecture hall you'd ever have. But the labs themselves are much smaller at 25. So I like to show this because even though it's a large lecture hall, it's not so large compared to a lot of big universities. And then here is a more medium-sized classroom. I like to show this particular room because it overlooks the best view on campus, which is our football field. So just a few more slides. We have an extremely high job placement rate overall in the College of Pharmacy and Health Sciences. Des Moines is an absolutely phenomenal city to go to college in, not just on the like professional side, but there's great restaurants. There's always a concert or a show or a festival to go to, and downtown is less than 5 minutes away. We're right on the outskirts of downtown. These are all things we've pretty much talked about, but the things that we really didn't get to touch on is study abroad. You can study abroad if you want to. And then the bottom one I love, you get to be a whole person. I know this session was on like our majors within the College of Pharmacy and Health Sciences, but if you want to sing in the choir, you can. If you want to double major in something outside of our college, you can. If you want to do an intramural, you can. We really do want you to be a whole person, and I think you can do that at a smaller school very easily. The application is now open, so if you're a senior, apply, apply, apply. And we have some visit days coming up. They're all virtual as of right now, unfortunately, due to the pandemic. But if you are interested, you can register for some of these upcoming visit days where you can get an even deeper dive into these programs. So I don't think I've ever talked that fast in my life, but we have 5 minutes for questions. Did any come through, Grace?
Not yet.
I'm sorry, I couldn't hear you.
Can you hear me now?
I can hear you now, yes.
Awesome. No, we have not had any questions yet.
Okay. Well, it looks like we have 4 minutes for anybody that does have any questions.
And stay on, because I do have a couple last minute reminders, but don't be afraid to ask questions, because this is a great opportunity to do that. It was really informative.
Good.
Yes. Okay, if they're not going to ask any, I'll ask one, or maybe that will get it started. I actually have one question, and I know this is probably really silly, but when the students are doing these programs where they're starting in the professional degree, you know, before they've actually earned their bachelor's, do they walk for a graduation ceremony after 4 years?
Yes.
They
Yep,
do. So
we want them to be able to, so like if somebody, for example, was in the 3+3 occupational therapy program, their senior year is technically their first year of occupational therapy school, of course.
Right.
But at the end of that year, all of their friends that they started with as freshmen are walking, and they will be conferring their bachelor's degree at that time too. So they will get to walk with all of their classmates for the bachelor's degree, and then they'll walk again in a few years when they get their doctorate degree.
Okay. I know that's might seem trivial, but you know, for a lot of people, it's their first time, maybe the first in family going to college, and you know, they want to walk.
Absolutely. It's such a milestone. I see we have another question. How does Drake help with students getting internships? Love that question. In the College of Pharmacy and Health Sciences, we have an office that's just for that. It's called the Experiential Learning Office. And we also have a career and professional development office just for our college, where they post internship opportunities. They help you do mock interviews, resume building workshops. You have to like try really hard not to know about the internships, because they're always very, very public, and they're always very communicated with students. And if you ever get the chance to visit Drake, which I hope that you do, if for no other reason, we have a live mascot named Griff 2. He is a bulldog. He is wrinkly and soft and precious, and he likes to show up on visit days. So hopefully, if for no other reason, you can come and get a picture with Griff.
I will say he looked really cute sitting on that throne.
Yes, he's very, very important, and he knows it.
I'm going to go ahead and put my screen up in case people, you still have a minute to ask questions before we have to end, but I am going to let you know that you will receive a short survey. It's very quick. It's 4 questions that you're going to be asked to fill out at the conclusion. And again, to remind you that there are still some sessions left, plus all those recordings at IACAC.org, and we definitely encourage you to check those out. Okay? We're right on time, so sweet. Thank you all so much. Have a great afternoon.
You too. Thank you so much for having us.
All right. Bye, guys.
Bye-bye.